Senator-elect, for being here, for making time. You have a few other things on your plate right now, I know. Why don't we start there? Transitions don't happen very often. What do you tell us about what that's like in the middle of a transition?
You've heard the term drinking from a fire hose. It's pretty much the situation. I have to tell you though, I am first off, very excited about this opportunity, obviously. But I just want to report to you things are going really, really well in our preparations to bring change to the state of Washington. I want to be a metric, results-driven governor. And the very first metric I have to report to you since my election is that the Seattle Seahawks have scored 266 points. And their opponents have scored 105. And when they get to the Super Bowl, if there's a single bad call like there was in the Super Bowl game against the Pittsburgh Steelers, they will be arrested. I want to guarantee you that. So I'm going to take care of that. It's very daunting, but actually very ennobling and confidence-building time. And I'll tell you why. It's daunting because you need to get a large organization up and running in quite a brief period of time from dead stop. So that's the daunting part of it. The confidence-building part of this is that the talent we have in our state is so inspiring, and we've been able to entice people with great talent to come into our administration. We're going to be announcing in the next few days some new cabinet members. We've been able to get some people in from unexpected places. You may have known our chief of staff is a woman named Mary Alice Huschel, who's the Renton superintendent, who has had spectacular results improving graduation rates. And what she has done is she's used a results-oriented approach. And by extension, there's a little metaphor or analogy to the healthcare situation from what she has done. She has judged performance based on outcomes and results rather than inputs. And as a result, the Renton School District has increased their graduation rate from 76 to 94% just in a few years. And they've essentially eliminated the achievement gap between kids of different ethnicities in math by really judging results rather than procedures and inputs. And I have been able to bring people into the cabinet already, we hardly have our cabinet filled, who are people who want to bring that management system to state government. And by analogy to what we're talking about today in healthcare, I think what she's been able to achieve, we need to be able to achieve in the healthcare field, which is to change our healthcare delivery system that we both pay and incent results rather than just inputs and procedure. And so what I've learned is that we have some challenges in our state, but we got great people to solve them. So it's been a real exciting few weeks.
Yeah. So campaigns are so obviously partisan. I hear, and maybe you could speak to really the warmth from everyone, regardless of party. Many folks I hear are very eager to help. They want to be involved. They want to participate. They want to. That must be. First, is it true that everyone wants to help you? And what sort of feedback are you getting from legislators, from citizens, CEOs, et cetera?
Well, I've been pleased that people want to all pitch in and help on a bipartisan basis, and they have. We're going to have some people, I hope, in our cabinet who, are of a different political flavor. We had our greatest, by the way, bipartisan success. We already had a bipartisan success. I want to credit one of my favorite Republican friends, Ralph Monroe. He serves on my transition committee. And we had a little problem because the inaugural ball was originally scheduled in a gym outside the city of Olympia, and we didn't think that made sense. I want to credit the Republican Party. Ralph Monroe got the inaugural ball switched back to the Capitol. That's a great achievement. That's a first success. Do we have our chair? Where's the chair of the Health Committee in the Senate? Where is she?
Senator Becker?
Where's Senator Becker here? I can't see out in the light. Somewhere there's a Senator Becker out here. I look forward to working with her. I think there is opportunities for a lot of bipartisanship in this field.
Yeah.
And the reason is that this idea of of having a results-oriented medical and healthcare delivery system really is not one that should be an ideological cleavage between the parties. This is something we ought to be able to embrace. And bringing evidence-based medicine into the fold is something we ought to be able to embrace. You know, when you think about it a little bit, I think this is one of those magic moments where we can have a transition of what the challenge is. The challenge for years has been to make sure that everyone has access to health care in our state and in our nation. And that did engender a lot of ideological disagreement, frankly, between Democrats and Republicans. That issue is pretty much resolved with the adoption of our health care reform. And I'm going to make sure that it's implemented in the state of Washington in a cost-effective way. So we've sort of got that battle, if you will, behind us. Sort of like the marriage equality battle. We got that that battle behind us now. It's behind us. So we can move on to some other issues. So now we've got a new challenge, which is how do we get cost-effective healthcare delivery system in the state of Washington that is so important to our business community. Our business community desperately needs a healthcare delivery system that can reduce the rate of medical inflation. It is the only way it can be competitive internationally. So now the business community and the entrepreneurial group in our state needs a healthcare delivery system that can reduce the rate of medical inflation. That's a business interest first. Second, it's a state interest. Both Democrats and Republicans have to understand, I think do understand, if we're going to finance education adequately, we have to reduce the rate of medical inflation in Medicaid, our state employees, and our teachers. And that's something that ought to be able to unite Republicans and Democrats to do that so we can free up, so we don't have to look at revenues, so that we've got efficiencies in healthcare. Mm-hmm. So that's something I hope we can find a lot of bipartisanship in. And the third is that just developing systems that are based on science and evidence. We're pretty good in our state relative to other states on having a delivery system that has less waste than a lot of other states. But we still have a long ways to go to make sure that when we do an MRI or when we do a CAT scan or when we do a particular procedure, it's based on evidence, on what really works. And we're making strides on that. The medical community in our state, we have some really great leaders that are leading that effort, but we could use some help on the delivery and payment models to make sure that that happens. So I think those three things have great opportunities for bipartisanship, and I have been very pleased at the response from friends in the Republican Party who want to help.
Well, I know the task I cannot really frankly fathom figuring out how to stand up the government in such a limited time frame. It's one thing to build a cabinet, it's another thing to hire all the thousands of folks that report to the cabinet members. And I don't want to get in the weeds on health policy, but I do want to ask about a couple issues that are really central to the things that you're talking about in terms of care coordination, cost control. And one is, both of which you care a lot about, one is diabetes. And maybe just offer some of your thoughts about how the state might, when policy questions come to you, and what are the personal elements or personal values you will bring to the question based on your personal experience with diabetes or your family members?
Well, I'll address it first as a father and a son, and then I'll address it as a governor. How's that? As a father, as a son, I've been touched with diabetes. My mom suffered from diabetes. It's a tough disease. This is a tough disease. It's a decadal battle, and I lost my mom ultimately to the ravages of diabetes. I have a brother who's diabetic, so I've had some personal experience with it. And so when I think about this issue, I have a very, very strong, passionate dedication to reducing the number of children in the state of Washington who are going to develop diabetes unless we figure out a way to reduce obesity amongst our young people and improve their nutritional habits and improve their physical activity. I do not want a single kid going through, frankly, what my mother and others have gone through. This is a very strong, deep personal commitment that I have, and I am very concerned that that's what we are looking at. The stats suggest that something like 30% of the The 10-year-old children today at existing levels of obesity and lack of health care are going to be pre-diabetic by the time they're aged like 35 or 40. So this is a tidal wave, this is a tsunami of diabetes that we're looking at. If we don't start now changing the way we live and our children live. So I have a personal commitment to that.
Yeah.
I have a professional commitment to it because as a governor who has to have a way to finance schools and education, we have a Supreme Court decision in that regard, we have to find a way to reduce healthcare costs. And if we do not get on top of this diabetes epidemic, it's going to swallow us whole fiscally. There won't be enough money in the solar system to finance schools if all we're financing are healthcare costs associated with diabetes. So I have a strong commitment to get on top of this. Now I think we have the start of ways to do that. First, we have healthcare reform, which is going to allow tens of thousands of people in the state of Washington to be able to get in there and get primary care so that they can stay out of the diabetic column and then stay out of the emergency rooms and stay out of the gangrenous limb amputation situation and stay out of cardiac events when we finally get people primary care. And so I'm very pleased that we have passed healthcare reform, and I'm going to be committed to making sure that we implement it. This is fiscally the sound thing to do as well as the physical sound thing to do, because for the first 4 years, Uncle Sam picks up the whole tab for Medicaid expansion, 100%, and thereafter 90%. And we save about $100 million right away transferring people off of one of our state-funded programs and put them on the federal dime. So this is a way we can help reduce diabetes to get people access to primary care, and I'm committed to make sure that's going to happen.
So on a personal level, the whirlwind that is standing up a government, what is different than what you imagined? I mean, what is the thing where you're like, well, I kind of thought I saw this coming, but it was actually that over here?
Well, I got to tell you, this is a personal aside. Maybe you won't spread it too broadly, but this morning I got up, Trudy got up before I did, and I came down, and she said, "How you doing, Governor?" And I'm not sure she'd ever said that before. It was kind of refreshing to have some at least feigned respect. So that's kind of fun.
That feigned respect thing doesn't happen very often, huh?
No, that was kind of, well, we're a marriage of a husky and a cougar, so that doesn't happen a lot in my household. So actually, this has not been hugely surprising to me. I've been around the bush, right? I was a legislator for 4 years out of Yakima. I've been in Congress. I've worked with a lot of governors. I feel pretty well prepared and sanded and I've been through the ringer. And so I don't feel like this is a foreign experience to me. Yeah. The biggest surprise to me has been a very pleasant surprise, and that's what I alluded to earlier, is that the talent pool we have had of people willing to come in to help state government. Brad Smith, who's chief counsel of Microsoft, has come in and he's one of my co-chairs of transition, and he's been working hours and hours every week to help us on it. We've had 1,900 resumes submitted, and you wouldn't believe the talent. In the next few days, I'll be announcing as one of my cabinet members, a CEO of a company, and this is a leader who's done really good work, and he's had a great business, and he's decided to come in and help a public agency. That's really inspiring. A person of that kind of talent will come in and help state government. That's been a pleasant surprise. So that's good news for us.
Yeah. Well, I know you've got a lot of other things to do, and I appreciate you being here. I will say that if we could encapsulate all of the wisdom in here, and I will endeavor to speak maybe inappropriately for a lot of folks in here, I think that the thing that would be near the top of the list in terms of what the healthcare community might want to see out of the next administration is first and foremost a willingness to listen and an increased level of stakeholder engagement that has been at best hit and miss in recent years. So I think to the extent that obviously you're open and looking for ideas, I think there are a lot of them out here that people want to give to you. I think people are chomping at the bit to sort of offer ideas and to see what is coming and how they might respond. Is there a particular way that you would suggest people communicate with your transition or new administration, knowing full well that it'll take time to stand up a cabinet, take time to stand up a government? Is there a point of contact that, on healthcare in particular, where you think people ought to be sending emails or policy ideas?
Well, DJ, you're a great point of contact to start with. DJ has been extremely helpful to me in the last year and a half developing our ideas on healthcare, and I hope you might continue to receive information and get it to me in that regard. So that there's one.
To, yeah.
I would think that there's multiple ways to do this and none of the wrong ways. We will have obviously a cabinet member and deputy that hopefully will have multiple ways to receive your ideas in person, by email, phone, and otherwise. We will have geographically outreach people across the state, so that if there are geographic issues in Spokane, hopefully I'll have an outreach person that can help with specific, geographically specific issues. Mm-hmm. We will have a legislative and policy shop, and that's led by a fellow named Ted Sturdivant, former Department of Ecology person, and they will have an access point for you. Mm-hmm. Grabbing me any way you can is good, personally and otherwise. Mm-hmm. We have, in this transition team, we've had a group that's helped us, and they will continue to be a conveyance point. I'm going to meet with them. We don't know whether it's quarterly or semi-annually yet, but we have a group, and DJ can help you find who is on that team to get to them ideas as well. So I think all of those are useful and helpful. And I'll just tell you, this is both extremely exciting to me personally to be governor at this moment on this issue in this state. And I'll tell you why. Governors in the next several years are going to succeed or fail largely dependent on their ability to be successful in advancing healthcare reform. And the reason is that these budgets are all going to be in extreme pressure, and that their ability to solve this mystery of healthcare reform in a way that's cost effective and improves health is absolutely pivotal to the success of any governor in any state. So this is absolutely one of the top things on my agenda, to work with you all to figure out how we do this, number one. Number two, this is the perfect state to be in, and you are the perfect people to work with for this reason. I gave a lot of thought when I decided to run for governor, and I decided to run for governor of Washington, not Arkansas. And one of the reasons is that we just have a very progressive, visionary community here in healthcare. We do lead the country in a lot of different ways today. So we got great partners to work with in this state. And I want to ask you to help me in a lot of different ways. We got so many different ideas to explore. The idea of direct service providers with the state, taking on a capitated service providers actually doing the work directly. I'm very interested in this subject. If we do it, how do we put fences around it? How it works? I need your advice on how to do that. Should we go the way Oregon is with community-based structures that they are now moving forward with? I am intrigued by this idea. If we do that, does it make sense to have a pilot program in one community? Would Southwest Washington maybe want to try this, since they're right next to Oregon anyway, and they have sort of a culture that likes that idea? How do we have a more metric-based system of evidence-based medicine on people's experience ratings? How do we embed that more in Medicaid? These are all ideas that I'm really intrigued by, and I hope you guys will help me implement.
Yeah. Well, I will just sort of conclude by seeing if you want to give us any insight as to what one might expect. This is as softball of a question as I could ask in terms of legislative policy. But any insight or ideas, or what are the kinds of things you've just identified, a few direct contracting, CCO kind of model, Are there other things that we should be watching for as the legislature unfolds in terms of healthcare, the budget, any other kinds of areas where you think that input would be most welcome?
Well, state of Washington's a pretty big gorilla in purchasing healthcare, right? We got over 55,000 state employees and teachers and Medicaid population and folks in our custody and corrections. We're a big player, and we need to be a big dynamic leader in healthcare for what the state does itself. Because if we do a good job in fashioning a new delivery system for all of those people who the state directly is providing care for, I believe it's going to help private business. The more we can reduce our costs and improve healthcare results for people under the state's care, I believe is going to help the Boeings of the world and the Microsofts of the world and the Amazons of the world as well. So one of the things I want to focus on is trying to, in my working with state employees and with the teaching community, and certainly in Medicaid delivery, to fashion these improvements within our own system. We can do that mostly without statutory changes. Mostly the governor is the player here without the legislature needing to be involved. So this is a place where a governor can be very proactive, and I intend to be that because I know how important it is.
Well, I got to tell you, having spent a lot of time with you in various capacities, there is no question but that you are a visionary leader. You'll be a visionary governor. I appreciate that about you. It's clear in healthcare. I mean, you simply, on the one hand, you cannot fund education and get people back to work unless you address healthcare. And I take it as, I think we all can take it as a demonstration of your commitment to this issue that you're here with us today.
Right.
So thank you for making time. I know you've got a tight schedule. Couldn't appreciate it more. We have, everyone who comes gets this bright, shiny, glossy book. And it is a series of contributing authors answering the question, if they had 5 minutes with the governor to talk healthcare, what would they say? So it has been in the works for a little while in anticipation of this moment where you get your very own copy.
All right.
So Governor-elect, thank you very much for being here.
Thanks very much.